I remember standing over his bedside in the NICU and just crying to the nurse, I'm a marketing professional, not a medical person. How am I going to do this? Like, I wish I could go back to myself and put my hand on my shoulder and say, you will change this ostomy bag in 60 seconds in a Buc-ee's bathroom.
Welcome to the Kids Health Uncomplicated podcast, an official podcast of Cincinnati Children's. I'm Kyle Breitenstein, and it's my pleasure to introduce your host, Dr. Patty Manning. Hi, Patty.
Hi, Kyle.
So, Patty, over your career, you've had so many conversations with parents right at the beginning of a different than expected journey. What do you wish you could tell every one of them right now?
Boy, I wish that I could tell them that they are going to meet an amazingly supportive community and team of people that will help them through this. I try and tell them in the moment, I tried to when I was clinically active, that I'm going to be there with you.
Yeah.
We're going to be there with you. You are not going to be alone. And there are a lot of resources that you can avail yourself of that will be helpful and that you can do this. And not only will you do it, you're going to be really good at it.
As it turns out, practice makes perfect.
Yeah. Who knew? Who knew?
What's something you would tell parents about the fear of the unknown as they begin a different than expected journey?
Wow. I mean, who doesn't have the fear of the unknown?
Right.
Who wouldn't like for things to be very predictable and follow the plan and follow the roadmap that you laid out?
Mm-hmm.
And so what I try and prepare families for, what I would tell them is that it's not going to go necessarily the way you think. And believe it or not, that's okay.
Yeah.
That the twists and turns and the journey you're going to take are probably going to be the best part. And that is impossible to believe right now or understand, but it is something I have seen time and time again.
And our guest today has experienced that different than expected journey, and she's become a pro.
That's right. That's right. We're very, very fortunate today to have Emily Kendall. She is a parent and a colleague and a friend of mine now, and somebody who's working in the space of building resources for adults with disabilities. And she's going to tell us about some lessons that she's learned raising her amazing 3 children. So please join us today for What Parents Wish They Knew Sooner, Uncomplicated. Welcome back, everybody. Thanks for joining us today. This is Kids Health Uncomplicated from Cincinnati Children's. I'm your host, Dr. Patty Manning, and we have a very special guest today. This is a person I've gotten to know very well over the past few years. Most importantly, she's a mom to 3 lovely children. Emily Kendall also does some very important work in the space of supporting and exploring living options for adults with disabilities. She's here today to talk to us in her capacity as a parent. And I have learned in my career that nobody taught me more or taught other parents more than parents who are going through similar experiences. So really excited to talk to Emily today about what she's learned being a parent. Thank you, Emily, for joining us.
Oh, Dr. Manning, Patty, I'm so thrilled to be here. Thank you. We have been Cincinnati Children's frequent flyers, so I have a lot to talk about.
So I'd love to start with you just sharing a tiny bit about your family and your kids, and then I want to follow that up with a question.
Okay. So I have 3 stepsons, and then together my wonderful husband and life partner, Mark, and I have 3 of our own. Emma, who is 10, Luke, who is 6, and Grace, who is 4. Emma was born 11 weeks early, spent 2 months at University of Cincinnati Hospital, supported by a team from Cincinnati Children's as well.
Yep.
Luke was born 3 weeks early. He made it.
A little further.
He was diagnosed at birth with Down syndrome and a colon condition called Hirschsprung's disease. And then a month shy of my 39th birthday, I found out I was pregnant with our 3rd. However, I had an IUD put in after Luke was born. So
surprise.
2 years later, I turned up pregnant, a 0.01% chance. Grace was born on her due date, but about a year and a half later, she got a diagnosis of cerebral palsy.
So you have really had some different journeys with your kids. And a question that I had asked a lot of my own patients and that I want to ask you is, now that you've been several years with each of your children through that journey, what would you tell yourself back then? If you could go back and say, hey, Emily, guess what I've learned? What would you tell your former self?
throw out all of your plans.
They're out of your plans. Okay.
Throw out all of your plans. No, really, I think one of the things is we're human beings. We all have expectations.
Mm-hmm.
But being a parent, whether your kids have medical complexities or spend time in the NICU or have a surgery, it's not going to go the way that you think it's going to go. So maybe hold your expectations loosely, or if you're going to have one, have the expectation that it's not going to go how you thought.
Yeah. As much as we want to control and have things be predictable, learning to be comfortable in that very unpredictable, uncontrollable space is probably a good life lesson in parenting, certainly parenting kids who have medical issues like yours have gone through. Is there a fear or a concern that you had early on that you found out was unfounded? Wasn't the case?
So Luke was born at Christ and then transferred about 3 days later to Children's, and at 5 days, they took him back for surgery because they suspected that he had this colon condition called Hirschsprung, where part of your colon doesn't have nerve endings. And I was very nervous to have my 5-day-old be handed over for surgery. Even though Emma had spent 2 months in the NICU, she didn't have to have any surgical interventions. So I was very nervous, and Dr. Beth Romeski walks in. And a big shout out to the entire colorectal team. She immediately put me at ease. So I was like, okay, you're going to do the surgery. That's great.
You got it.
But then Luke came back with an ileostomy,
Wow.
which is where his small intestine is routed to his stomach. And he has an ostomy bag. And I was very nervous about that. I remember standing over his bedside in the NICU and just crying to the nurse, I'm a marketing professional, not a medical person.
Oh my goodness.
How am I going to do this? And it's now no big deal.
Right.
Like, I wish I could go back to myself and put my hand on my shoulder and say, you will change this ostomy bag in 60 seconds in a Buc-ee's bathroom when Luke is 5 years old. You can do it in the semi-darkness while he is still sleeping. It will become a part of your life and a part of Luke, and you're going to navigate it and handle it. So I think my fear is that I wouldn't be able to handle it.
But you did.
But I did.
I have heard so many versions of that, whether it was a family whose child had to have a tracheostomy or a G-tube, this overwhelming sense of like, I can't do this. And then fast forward, you're changing a trach better than, some of the medical team members. You're changing a bag in the dark or something like that. So I love when a parent can tell other parents, you can do this. I did it with zero healthcare background. You're going to be able to do it. I want to go back to my previous question too, and now make it a little bit more specific to the fact that you have a son with Down syndrome, and he's grown up quite a bit, obviously, but still a young child. And we know many families are raising children with different disabilities. How would you talk to a family who's just had a child with Down syndrome, just born? How would you help them through what you've learned as a parent of a child with Down syndrome?
Well, that's a great question, Patty. Oh, there's so many things. Luke was an at-birth diagnosis, and I'm very fortunate. The family that my sister and I babysat for growing up, their aunt had Down syndrome.
Oh.
And then my babysitter growing up, her oldest daughter has Down syndrome.
Oh, my goodness.
So I have some resources that I could rely on right away. And we had a nurse that got us connected to the Down Syndrome Association. So if you're based in Greater Cincinnati, that is an excellent organization to get you started and get you connected with, and was really very helpful for our family. I do think, again, this loops back to the expectations piece. For us as parents, we have this expectation of what our child's life is going to be like through our lens. And the truth is, you can't really have that expectation whether your kiddo has a disability or not.
Yes.
And at the same time, I had a conversation with a friend of mine about this yesterday. There is a grieving process for those expectations, and you have to move through them and process them, and you have to move forward. Being Luke's mom, being all of my kids' mom has changed my life, but Luke in particular has a set of gifts that I don't have, which is living in the present moment, patience, kindness, emotional intelligence that's off the chart. I did not know the name Luke meant light until after he was born, but I did know that was going to be his name.
Wow.
And he is a light bearer, and he lights the way for Mark and I to do our work around housing for adults, because we know that he's going to outlive us. And what is that going to look like? And it turns out millions of other families are in that same boat.
Yep.
Give yourself some time. There's a great piece by a woman that's called like Welcome to Holland, I think it's called. And, you thought you were going to go to Italy, but instead you're in Holland, and take advantage of what Holland has to offer.
No, I appreciate your recognition of that piece. It's referenced a lot in talking about raising a child who is different than you anticipated. And I think it's important to recognize that grief is normal, that grieving the child you thought you were going to have, that's normal. It's okay.
Yes, it is normal.
It's normal, and accept it, move through it. And then there's this amazing community of people that you never thought you'd have to be availing yourself of, but they're there. And so that makes me think of my next question, which is around resources. You kind of touched on this, but resources, whether it's specific to Luke or just in general, are the resources that you have used or accessed now that you would want a new family to know about, or that you would want any family to know about, that might have taken you a little longer to realize, hey, this is a great resource. You should use it.
The Down Syndrome Association, like I said, but if you end up with long hospital stays, the team at Children's, there are so many resources to help navigate the hospital stay. There's Child Life. There's one that I am so glad that I learned of, integrative medicine.
Oh, wow.
This is a team of nurses here at the hospital that are trained not only in Western medicine, but in Eastern medicine.
Yep.
With things like healing touch and aromatherapy and Reiki. Luke was in pain. His heart rate was really elevated. I watched them come in and get his heart rate down within a minute because of healing touch and aromatherapy and their presence. It was very powerful. And then the other piece is the financial team. They got us connected to a grant through the United Healthcare Children's Foundation to help cover some of Luke's speech services. I would also shout out to the department that you helped get started here at this amazing place, DDBP, Department of Developmental and Behavioral Pediatrics. They're a wealth of knowledge and resources. And the Thomas Center, if you have a kiddo that has Down syndrome, they're indispensable. And then complementary is the Kelly O'Leary Center for Autism Spectrum Disorder, which of course wouldn't be here without you.
Near and dear, yes.
Another great resource is if you're in the hospital for a long time, they have some great play rooms and play areas. You can get out of your hospital room
into another space.
Which is really helpful. That leads me, Patty, to another one, which is lactation. The lactation team, instrumental in helping Luke really get a hold of breastfeeding.
And he did.
For 9 months.
As a baby with Down syndrome.
He breastfed for 9 months. Until I think he got tired of looking at my armpit. And he's like, I got other things to see. So
got to move on. Well, you have done an amazing job of listing so many resources in so many different categories: medical, hospital-based resources, community resources. And I suspect that you availed yourself of personal and family resources too. And I feel like the name of the game here is, as scary as it might be to have a child who's hospitalized or diagnosed with a condition at birth, if you can look up and look around and say yes to the help that is there for you, it can be an amazing tool.
Yes, it can. It can. And I think one of the things that I learned going back to your advice question, don't be afraid to ask for help and be specific. People want to help, but sometimes they don't know how.
Right.
So when Emma was in the NICU, I was like, I would get all these messages. How can we help? And so then I was like, okay, well, people want to help. And I gave them a list. Mark needs help moving pavers at the house.
Yeah.
Can someone come do that? We would love food because we're at the hospital. Can someone help us provide some food? If you want to come down and sit with us in the NICU or go read to Emma, like, let us know. Be specific. People want to help, but sometimes you have to give them
be
directions.
directive. Well,
yes.
You have shared a wealth of helpful information for parents and families. I can't thank you enough for allowing your personal experience to help families who might just be starting on a journey.
If I could just end on a note of,
please,
trust your instincts and trust yourself. You are your child's best advocate. We have amazing medical experts, but you are the one that knows the curve of your child's fingernails or the way that their eyelashes rest on their cheek when they're sleeping. Take advantage of that knowledge and love that you have for them, and don't be afraid to ask questions and advocate and tap into those resources. You can do this.
Oh, thank you so much. That is perfection. That's a chef's kiss. Thank you.
Okay, Emily, Patty, we like to close all these episodes with a segment that we call Myths versus Facts.
Okay.
I'm going to give you a bunch of information that may be true or false. You just relate it to your journey as a parent.
Okay.
Okay? And you tell me whether it's a myth or a fact.
Okay.
So myth 1, it's not okay to ask your community for help.
Oh, I think that's a total myth.
It's a big myth.
People are ready to help.
Yes.
This whole hospital is ready to help.
We've both seen in our different avenues unbelievable kindness, not just of familiar people, but sometimes even of strangers.
People want to help.
They do. They really do.
Myth or fact, the hardest part of any journey like this is the diagnosis.
I also think that's a myth. I think it's not the diagnosis. I think it's more, how do you navigate your own expectations of what that diagnosis means? How do you process through what you thought your life would look like to make room for what your life is going to be like? Patty, you alluded to it. We have met some of the most incredible people.
Yeah.
I would not be sitting in this chair if it was not for Luke Charles Kendall.
That's right.
It's not the diagnosis itself.
Right.
It might be some of the structures in the world. So
the diagnosis is a moment, and it's a tough moment, but it might not be the toughest moment. But the toughest moments are balanced by some amazing moments, which I love that you point that out.
yes.
Thank you.
And that's life. That
is life.
That is life. That's what my dad would always say to us. It's a beautiful life, but it's also not heaven.
Yeah.
And it is, there's the good and the bad and the ugly.
That's
and,
right.
He would say, being a parent is one of the worst and best things that could ever happen to you, because your heart is outside of your body.
That's right.
And you said it beautifully earlier. Enjoy Holland. Holland's pretty good.
Holland's a beautiful place.
Right. They have Stroop waffles. Let's go.
What's wrong with, what's better than that?
Okay, myth or fact, planning for your child's future can wait until they're much older.
Oh, planning for your child's future can wait until they're older is also a myth, especially for a kiddo with a disability.
Yeah.
And that doesn't mean, look, you have to have it all figured out. But I think about, for Emma and Luke and Grace, what are things that we can teach them that are age appropriate now that will serve them later in life? Who's going to help take care of the dogs? You guys are. Who's going to help put away your laundry? You guys are. For Luke in particular, showing him how to make choices and advocate for himself. It is never too late. I do think there's a financial component that you do have to start thinking about earlier. Mm-hmm. There are things like setting up some of the legal mechanics, like a specialized trust to ensure that your loved one's benefits aren't jeopardized if it's not structured the right way. On the flip side, you can get very bogged down in planning and worrying about planning and not enjoying your life.
It's a balancing act. And I think that we do have to think about the future a little bit sooner, especially for children with disabilities. Certainly the work that you and Mark are doing has been informed by knowing that Luke will need some options for where he lives as an adult. But you can't be so future focused that you don't enjoy today. So
that's right.
For the parents that might be listening who are on a different than expected journey, are there any resources that either of you have that might be useful to them?
The Family Professional Resource Center at our hospital at Cincinnati Children's, or comparable entities in your community, wherever you're watching this or listening, these resources exist that help families understand, okay, I have been I have been given a different hand of cards or thrown a little bit of a curveball. That type of setting, Family Professional Resource Center, which is a little bit of a clearinghouse for all kinds of more diagnosis or condition-specific resources, would be a good place to start.
Good information. Okay. Emily, thanks for being here.
Thank you, Emily. This is, as I said when we started, I think there is no better source of trusted information for families than other families who've been in their place. So thank you for sharing. We are very appreciative.
You are most welcome.
That was What Parents Wish They Knew Sooner, Uncomplicated. Please join us again.